these chairs are too big for one person and too small for two, so me and this really tall doctor are going to attempt to fit right here. Hello everybody, my name is America Revere. I'm a third-year medical student, but you guys know me. I don't think you've met my friend.
Hello, my name is Webb. Nice to meet you guys.
And what do you do and all that jazz?
All right, cool. I'm a chief resident orthopedic surgery, and I'm happy to be on your show.
Oh, thank you. A lot of people would love to be in your shoes. A lot of people want to be an orthopedic surgeon. No, it's awesome that you live the dream of so many. Yeah. But of course, how you get there is probably pretty hard, and we all want to know like everything about it. So can you tell us just from the beginning, why did you choose medicine?
I went to a high school program in Louisiana, and that's what got me interested in medicine. Ever since then, I wanted to be a doctor since I was 17, basically.
Is your family, are any of them physicians?
No, I'm the only physician in my family.
Oh, okay, awesome. Yeah. Is there something that your family does? Like maybe they're all lawyers or they're all car salesmen and you're not?
Military. Most of my family's military. I was in the military as well.
Oh.
I went in the military at age 17 and I did 8 years in the Air Force.
You missed that detail.
Yeah, went to Iraq in 2005.
And then why did you choose orthopedic surgery?
I love working with my hands. When I was growing up, I always liked to putting things together or breaking things down and putting it back together. So orthopedics is a very reconstructive specialty. We use a lot of tools that are kind of in your parents' garage, like hammers, drills, screws, wrenches, everything in the garage. So it feels like I'm just playing in a toolbox at work. So.
But with human bodies.
With human bodies, yeah.
How was medical school for you?
Medical school was a blur. It was challenging as well. I went to med school at Georgetown out in DC. It was a lot of fun. The first few years was it's a transition, trying to go from college to medical school. But third and fourth year were a blast. I had a lot of fun. So.
Oh really?
But,
ooh, okay.
So you got something to look forward to.
Yay!
Wow.
It's one obnoxiously loud door.
WD-40.
To be an orthopedic surgeon is really competitive. What did you do in medical school to be competitive?
You have to have a really competitive step 1 score. Outside of that, I would say research, connecting with the right mentors, finding something in orthopedics that interests you, and then going after that, whether that's doing a project or becoming a part of the orthopedic interest group.
What were your studies? It's really hard to start. No, okay. What were your study habits in medical school that allowed you to have that competitive step 1 score and GPA and all that to land your position?
I was very disciplined, coming from the military, where everything was really structured. We got up at a certain time, we had to make our bed a certain way, our boots had to be shined. So I used that same mentality in med school. I got up at a certain time every day, I had a set schedule, I had everything planned out. Before the day even started or the week started, I knew exactly what I need to accomplish that day. So wow. I think just being very rigorous and very structured in my study allowed me to be successful.
Oh, okay, wow. And like you still have that kind of schedule now?
Absolutely, I have surgeries tomorrow and I'm reviewing my patients' charts and getting all of their orders ready and making sure everything is ready to go for the next morning.
Oh, okay.
So I know exactly what I need to do this week.
Oh, wow. I wish that was my life. I somehow, go about medical school with zero idea what's going on. Should we move around to a different location?
It's up to you.
Let's do it. What doctors eat. He's carrying this around. I'm just kidding.
Hey, these are fudge. I never had this before.
Look at these cool chairs and office these guys got going on. Alrighty guys, so now we are in the ortho office, which is just very fantastic and sparkly and not at all plain.
Yeah, really dry in here.
You just go ahead and let us know what a week in your life is, because I think everyone's kind of confused with what you do and how much you work and how much time you have free.
It just depends on what rotation you're on, and also depends on your PGY level. In orthopedics, we do 2-month rotations: hand surgery, foot and ankle surgery, joint replacement, shoulder and elbow, oncology, trauma surgery, which is our busiest rotation, and then
broken legs, stuff like that.
Gunshot wounds, motorcycle accidents, crush injuries. Some rotations are busier than others. Others are really busy. Other ones are kind of laid back. If you're lower level, kind of PGY 1, 2, maybe 3, you may work more hours than the person who's upper level. Or you may be at the hospital a lot longer. So as a chief, I get to be at home for most of the time when I'm on call.
Chief, what does that mean? What PGY are you? 5. Oh, okay. And then when do you become an orthopedic surgeon?
After this year. Orthopedic residency is 5 years long, so you do 4 years of med school, 5 years of surgery training. And then most people do a fellowship. So you can do sports medicine, but I'm doing a spine fellowship, so I'm gonna be a spine surgeon.
Oh, really? How many hours a week do you think you work?
ACGME, 80 hours a week.
Having a family and being an orthopedic surgeon is like possible, right? Compatible?
Yeah, I mean, any specialty is possible. Probably a little bit harder for a woman, I would imagine, because you have to actually bear the child, but yeah, it's definitely possible.
So I noticed that orthopedic surgery seems to be dominated by, you know, in my experience, tall males. Not just males, but like they're all tall and like buff. And I don't know why.
Yeah, I mean, it's a requirement. You have to be at least 6'2", at least 200 pounds. You got to be able to bench press 250 pounds as well.
Do y'all go to the gym together?
I'm completely joking. Orthopedics is very physically demanding. In surgery, we're using hammers, reducing shoulders or hips. That's a lot of physical.
It is?
Yeah.
Like it's a workout?
It's a workout.
So it is kind of like a carpenter.
Absolutely.
Oh,
yeah.
Wow. Except human bodies, of course.
Yeah, so when someone has a knee arthritis, I cut the tibia and I cut the femur with a saw, and then we use little chisels or osteotomes to kind of mold it and put a prosthesis in it.
Also, Dr. Webb, why do you think this is a male-dominated field? Why is it that women almost make up a very small percentage of this residency?
I don't know. I think it's something that has been going on for a long time.
I kind of never really considered orthopedic surgery because I hear it's just a lot of hours, and every orthopedic surgeon I know is always on the go and busy and got calls. And that's kind of the reason why I, as a female, would be kind of hesitant, especially if I would want a family in the future, to pursue it. So do you have any remarks or words about that?
Absolutely. And I thought the same thing. One of my mentors in medical school, he stated that when you think about a specialty that you want to choose, you have to think about lifestyle, prestige, money, passion. I can't think about the fifth one, but something's going to have to give. For me, you got to figure out what's most important to you. So me, it was something I was passionate about was orthopedic surgery. And also the plus is the pay.
Pay's good?
Pay is very good. You go into something like pediatrics, which is a great field. We need a lot of good pediatricians, but the prestige is not there. And also the pay is not there, but your lifestyle, you have a better lifestyle. Pay is important to you. Go into neurosurgery, but your lifestyle is going to be affected by that. Orthopedics, I think, gives you a good balance of good lifestyle. You can raise a family. You can have kids. One of our chief residents is pregnant right now. The chief resident who just graduated, she just had a baby. We have
possible.
So it's very possible. People in my program who have 4 or 5 kids. I think it's a really family-oriented program or specialty in general.
Okay, wow. That's very interesting to hear because it goes against a lot of rumors.
Yeah, so there's a lot of myths out there and a lot of rumors, and people think surgery, you can't have a lifestyle. Even as a resident, I've probably been to maybe 4 or 5 countries in the last year and a half.
Oh, wow.
So
it's more than my whole life.
Yeah, every residency is going to be busy. Even family medicine, pediatrics, psychiatry, you're going to have a busy residency. Find something that you're passionate about. And once you graduate, you can be a neurosurgeon, work 3 days a week if you want to. You can work Monday, Tuesday, and Wednesday and say, I don't want to work Thursday and Friday and spend that time with my family. You have that power to do that.
Put in the time and it's worth it in the end.
Absolutely. Prestige means being respected by your colleagues, having a level of success or achieving something that you kind of put your mind to that is kind of well known among your peers. Everyone who knows someone who goes to Harvard Law School is well trained. So same thing in medicine, neurosurgery, dermatology, orthopedic surgery, plastic surgery. Those are really prestigious specialties. Someone who gets into plastic surgery had to work really hard in college, med school. You can just look at that person, you know, you can just tell that that person didn't slack off or didn't get through this whole process the easy way. I haven't experienced any bullying in residency. I think there's some specialties that are kind of prone to behavior as such, but those things are kind of not really allowed these days. So absolutely, when I'm getting up, getting ready to go to work, I'm excited to come back and operate again because it's so much fun. Patients do well, you get immediate gratification, and there's really no other job like it. It is a really demanding field, from using instruments like a drill or a hammer, a lot of repetitive motions. When I operate, I bend over a lot and I look down. You can get neck pain, carpal tunnel syndrome. So I would say work hazards, and you don't have that in other specialties. We work with the Spurs, so we work with the doctors who work for Spurs. So I was able to go to the playoff games with the Spurs and go to the locker room when some of the players got injured. If medicine is something that you really want to do, never give up. when I was applying to med school, it took me 3 years to get into med school. I got rejected my first 2 years. If it would have took me 10 years to get into med school, I would have did it because that's how bad I wanted to be a doctor. And if you want to be a doctor that bad, someone's gonna let you into their med school. If you want it that bad, you'll eventually get it. So basically never give up.
Alrighty guys, well it was nice hanging out in the orthopedic surgery office. Very cool here, very nice tables. And it was also wonderful to have you, Dr. Webb. Very insightful, even for me, and I'm already halfway through. Thank you everyone for watching the video, and I will see you in my next video. Goodbye everyone.
See you later next time.
If you want more of Dr. Webb, be sure to follow him on all of his social media, including his own YouTube channel, and he has his own book called Overcoming the Odds. Thank you everyone for watching. I just have one more question for all of you. And Dr. Webb, final question. Is it true that you guys play golf a lot?
Yeah, we do play golf.